Hi, I'm Dr. Lopez-Belio, and I'm going to show you how the CEREC works. We have prepared a tooth for a crown, and now we are going to take an optical impression. That means that the patient does not have to have all that goopy mess in their mouth. We're just going to put a camera, and first we're going to powder everything, keep everything nice and dry, and then we're going to take a picture of it. Bite, and we're going to capture her bite. And that way we know how tall to make the tooth. Now we're going to start designing the crown on the computer. Okay, so you can watch as we go. Now we can see the inside to make sure we have adequate thickness. Okay. Once we've approved the restoration and we've seen it in all different views and it, fits the model really well, so we're ready to mill. So let's go walk over to the milling station. We use Emax blocks, which are lavender color. This is very, very strong porcelain, and this is compressed into a block. So we're going to put this in our milling chamber, and the porcelain crown will be made out of this. The nice thing is that traditionally we would have sent it to a lab, and the lab man would have layered porcelain, and there would be more possibility of porosity. So with this technique, the crown or the onlay is very, very dense and strong. Okay, so let's go put it in the chamber. Place our block into the milling chamber, and we have two different burrs. They're going to start doing the grinding process. So we close our... Now the burrs are being positioned so that the preparation can be made in the most efficient way. And pretty soon... Okay, so now our crown has finished milling. Okay, and we're going to go take it to our oven. And Danielle is going to do the stain and glaze on it.
Okay, now we have our block, and it's lilac color, but once we stain it and we put it in the oven, it's going to look like a real crown. And we'll start by staining it and glazing it. So just put a little bit of glaze all around. We're going to put it in we're going to put it in the oven now. It's going to crystallize. Okay, now it's ready. Take it out of the oven, and here's our finished product. Now we're going to be putting it in the patient's mouth.
And now we have our crown that we're going to insert. Looks like a perfectly natural tooth. Okay?